Okay, we're going to talk about infection. That's the problem. Most of the times women have infection, fluctuation in period, thick flow, heavy flow. Some will say semen, ovulation. Some say these one many things. Some men will come out having scratching, having pains. Now, what are the basic tests we run for this infection? On one basic test, there are a lot of them, but we're going to talk about the culture and urine analysis or urine analysis. What culture does, culture we use to isolate the microorganism. Samples are classified. For example, when they say, okay, go and collect, you have urine culture, stool culture, sputum, MCS, all of them. So those samples, what we actually do in culture is to isolate the pathogen that causes that infection or disease. So that's what culture does in antibiotics. So culture is a very basic test every man must run. In as much as you're having any form of any symptoms are present, culture is basic. Why do I say it's basic? Because of the issue we are having recently, issue of antibiotic resistance, you can just go to a pharmacy and having headache and fever. Pharmacy will just give you a drug, but the pharmacy is not current. What that drug is giving you is not sensitive to your body. So you see why culture actually brings out the bacteria and nobody brings out the drugs you're going to take. So it's very important to run culture test. Don't neglect it. Okay, look at the bad thing there. Okay, you after treating yourself without culture, maybe say after a week or two, that same symptom still present. You see how to spend the money again to go out for another lab. You spend money for treatment, to school pharmacy again for culture again. Now you have to buy drug again. So why not just go straight and run diagnosis? I think people need to be more sensitized about this health of issue more because anytime I have issue, first thing go for it. Go and visit, go to hospital, see a medical doctor. The doctor will book the laboratory investigation whereby the culture is there. Then we look at what your cause. Is it staph? Is it E. coli? Is it Klebsiella? There are so many bacteria. And every bacteria have its own antibiotics that handles it. So like for example, we have the infection. We have an infection as a lady, and they are giving drugs like erythromycin. Erythromycin, we all know that has to do with upper respiratory infection. So it have nothing to do with that side. So culture is a very basic investigative test every man encourage everybody that has infection to do.